webinar. So, welcome everyone to this webinar on putting health tools into practice. We're going to talk about designing feasibility studies at an international scale, which is a big focus of the SmartCHANGE project. Let's have a quick look at the agenda to start. So, first we have an introduction by myself, Trust IT Services, the communication partner of the project. We will be looking at the two applications that have been developed to focus on the objectives of the projects, which is the development of a health ecosystem by the two technical partners, Connected Care and Engineering, before looking at the meat of the webinar, which is the feasibility studies that will deploy these solutions. So we have 5 different pilot sites, which are respectively Ljubljana, Jyväskylä, Amsterdam, Porto, and Taipei. So quite international, as you can see. We have representatives from each of them. We have Professor Gregory Rock from ULJ. We have also a couple duos. We have Tuija Tammelin and Heikki Laaksonen from JAMK in Finland, Claudia Dictus and Mariette Hogsteder from VMC in Holland, Jose Carlos Ribeiro, who unfortunately, due to some unexpected issues, could not be here with us today, so will be replaced by myself from Porto, and Shirali Bomra from Taipei, presenting how each of them will be using the applications and the systems developed by the project in these feasibility studies. We will also have a short Q&A session near the end of the webinar. So if you have any questions during the presentations, feel free to write them in the chat, and then we will address them during this section. And finally, we will have just a minute or two of closing by myself and what the next steps are for the project and for anyone interested in participating and following us along. With that said, just a couple notes on housekeeping. First of all, as said, feel free to say hi in the chat and to write any questions, which we will address later. We have a bit of a cozy webinar, so it's good to be active together. Secondly, the webinar is recorded. The recording will then be posted on YouTube, and we will share it on the social media and on our website. So if you, for some reason, cannot attend the entire webinar or you miss a part, don't worry. The resources will be shared with everyone. And to stay informed on upcoming events and other updates, you can find all of this on our social media channels and on our website as well, which is smart-change.eu. So feel free to check that out if you haven't already. So let's talk very briefly about the project. SmartCHANGE is a 4-year-long Horizon Europe research and innovation project, started in May 2023 and will end in 2 years, in May 2027. The research topic is trustworthy AI tools to predict the risk of chronic non-communicable diseases and or their progression. So we have been funded together with a cluster of other projects which we actively work with. And we specifically are developing what you can call a health ecosystem. So we developed 2 applications, a web application and a mobile application, which will then interact with the families and the healthcare professionals. This is a diagram showing basically the idea behind the health ecosystem, which has a lot of moving parts, but you will have you will find it again in subsequent slides, so you will get quite well acquainted with it, showing how the different parts, both of the SmartCHANGE project and of the people working in the healthcare ecosystem, should interact. Currently, the project is moving forward with the deployment of this multi-pilot site testing of the system. So the 5 sites we mentioned previously, and it's pairing it alongside different health infrastructures in different national and social contexts. So we have schools, we also have independent healthcare professionals, pediatrics working with families, and other contexts. So these are the 5 feasibility studies, which are the meat of the webinar which we're talking about today. So with that brief introduction out of the way, I'm actually going to pass to the first part of the applications that have been developed for the project. So with that, I'd like to give the floor to Harm Optenacker from Connected Care to showcase the mobile application which has been developed. Thank you.
Thank you, Diego. Let me share my screen. I hope you can all see this.
Yes.
All right, so thanks, Diego, for the introduction. It's my job today to give a little bit of context what we're talking about from the point of view of the mobile application that's being developed for children and adolescents. My name is Harm Optenacker. I work for Connected Care. And our role in the project is to co-design and build this application mainly. Application has been designed under the supervision of my colleague Lotte van der Jacht, who has also provided me with these beautiful slides. And of course, the entire SmartCHANGE consortium that has contributed and many, many different stakeholders throughout all the different co-design sessions. So what's the goal of this application? To stimulate and engage families, children, and adolescents throughout their personalized journey towards a healthy lifestyle. That's, let's say, the very short elevator pitch. What that means, we'll see when I'll show you some screenshots. But what's important for this application to keep in mind is that we aim to provide personalized and clear goals for, let's say, the kids to achieve. Because of the young age of the target audience, we've also opted for a gamified experience. Not only nice for young people, also for adults, but in this case, particularly relevant. We want to offer content in the application that changes over time and maybe even also adapts to the preferences of the child. A holistic approach, so many different factors of health are being included. But the most important point is that we give autonomy to the end user, to the child himself, to choose what parts of health to work on and how. And also there should be an educational component. We're not just telling people what to do, but we also want to educate them about healthy lifestyle. So at a very brief overview of what this actually turned into, let's say, the Happy Plant app. In the Happy Plant app, children can connect the application to a wearable device from Garmin that tracks their physical activity, how much steps they're doing, how many minutes of vigorous activity they're doing, how many minutes of moderate activity, and also how they sleep, when they go to sleep, when they wake up, and how well they sleep, let's say. This information, combined with a few small questionnaires that we include in the application about their diet mainly, provides input for the risk prediction modules that are working in the background. And those risk prediction models give a kind of indication on whether this person is at risk of in later life developing certain diseases given their current lifestyle. So if that's the case, then now is a good time to try and do something about that. And the way we aim to entice the children to do something about it is through challenges. So we set high-level goals for them, for example, to get a bit more active or to sleep a bit more, a bit longer, a bit better. And based on those high-level goals, we present children each week with a set of challenges. And those challenges are, let's say, 20, 30-minute activities that they can do once, or maybe a challenge to do something for 5 minutes every day. And by completing a challenge, children can earn water. And the water is used to feed their plant that they have adopted. In the beginning of the application, the child can choose which plant. You can see a few different examples here on the screen. That starts off very small, and by feeding them with water, you know how plants work. They grow. And when they are finished, when they've grown to full size, let's say, the plant is completed and can be planted into a garden. And the garden can have a kind of a longer term goal. Something that they can agree with their parents, like if I complete 6 plants, I can finally get my new PlayStation game. Playing PlayStation games is not healthy. I didn't say that. Just as an example. So some more. When children first start using the Happy Plant app, we cannot really give them a risk prediction yet because we first need to collect some information about them. Our algorithms in the background would like to have at least, let's say, a week of data to work with. And so for that, we have designed this introduction week. So the first time you open the application, you're not getting challenges right away, but you're being guided through a 7-day program in which you can kind of prepare your garden for plants. On day 1, you're cleaning up the mess. On day 2, you're fixing the window hinges. On day 3, you're adding lamps and sun shields, etc., etc. That happens through a bit of an educational module where we have a little conversation about 7 different health topics. And after going through that conversation, you can complete one step of the 7-day introduction week. And then after this introduction week is over, and in the background, we have been collecting enough data to give your risk prediction, you can adopt your first plant. And then the let's say the regular cycle of Happy Plant use starts. So again, some screenshots of this process. On the left, you see the assigned health goal. So this is a healthcare professional that, based on your risk prediction, says, well, I'm going to choose these 3 or 4 higher level, longer term health goals for you, and you can see them in the application and track the progress. Then based on these health goals, our system suggests every week a list of challenges that you can make choices in. So you can choose to commit to 4 or 5 different challenges from the list. Each challenge is worth an amount of water. You have to find a collection of challenges that equals a certain amount of water that is suitable for 1 week. And then completing a challenge, you can fill up your bucket of water and then water your plant. Then there are some things that are not completely in the application yet, but we have way more ideas than we had time to implement. But here you see, for example, the idea of earning some coins. You completed the growth of Benny. Benny is the name of the plant that the child can choose himself and collect 10 garden points. And with these garden points, we can then implement features like buying accessories for your plants to make them look nicer, give them a little hat or some sunshades or a funny Halloween outfit. These are, disclaimer, not in the application right now, but they are very much in sketches and designs and in the back of our minds and on our wish list to implement. So with that, I hope I did about 7 minutes. And I'll give the floor back to Diego. Thank you very much.
Thank you, Harm. So that about shows the application on the side of what the families and the youth will be dealing with. We have now the other side of the coin, which is the application that has been developed to work with healthcare professionals. So this will be presented by Valentina Di Giacomo from engineering. Valentina, over to you. Thank you.
Oh. Okay, so I'm going to present the web app for healthcare professionals, as mentioned by Diego. So some context: the web app is a browser-based client that is designed for healthcare professionals mainly, but also for teachers and the study administrators. It supports the promotion of healthy lifestyles and the early prevention among the users of the SmartCHANGE projects, so children and adolescents. So it serves as a central interface to access, interpret, and act on health and lifestyle data, and they are mainly collected through the Happy Plant and the wearables that the children will wear. And potentially it's open for integration with other data sources to integrate all the sources within this central. The web app was designed as the Happy Plant app in a co-design process that included users from all the study sites, and also integrates principles from behavioral science. So, okay. The main objectives of this web app are to provide, as I mentioned, an intuitive dashboard for the preventive follow-up of our young users, and to enable data-driven insights through both the prediction models and these models are based on lifestyle and well-being indicators collected from the web app, and also input a dashboard from clinicians. So it supports personalized recommendations that guide the Happy Plant activities, as I mentioned before. And it fosters communication and engagement between practitioners and the users. So it promotes a healthy communication and approach when the users meet the practitioners. So going into the main features of the web app, it can collect and aggregate the data from the Happy Plant and the other sources into a graphical form, and give an overview of the status of the person, practitioners, so that they can make the decision on their status, and also on the progress of the person over time. Another aspect is that it helps practitioners when they meet with the kids and adolescents, providing a step-by-step guidance for the consultation, and supporting the efficiency in the daily practice. So as you see, it guides through the process of a consultation, but keeps freedom in changing this process. So it's just a support tool. It doesn't prescribe the way the consultation should be carried on. Another central aspect in this project is that the web app enables risk prediction, integrating the risk prediction models developed in the project. These models identify emerging lifestyle risk patterns, and the web app shows the results of these prediction models together with explanations that enable trust and understanding from the practitioners into the outcomes of these. And also the web app allows practitioners to suggest preventive actions based on the results of the risk prediction models and the assessment on the data that was provided by the users on their lifestyle habits, and also some physiological aspects. The guidance is supported by principles that are listed in the web app that promote a positive environment when deciding a plan for lifestyle change. It allows to select the best approach and the best lifestyle changes that can affect positively the health of the person, and can be personalized by the practitioner with their own knowledge of the person itself. So this guidance will course, impact on the selection of the activities that are presented by to the users by the Happy Plant. The practitioners is also allowed to monitor the progress of the people over time, and in the specific, they can monitor how the goals that they have set are being reached, and they can through that track the activities that are promoted by the Happy Plant app. More or less, I told you the main topics that are addressed by the web app. So thank you.
Thank you, Valentina. So with all that said, now that we know the tools that we're using, let's move on to the sites and let's see how the different sites are going to use them in their specific context. So I'll pass the floor first to Gregor, who has already moved in anticipation to have the slides up. So thanks, Gregor. And the floor is yours from Ljubljana.
Yeah, thank you, Diaga. Welcome from Ljubljana. So I will present how we designed this feasibility study in Slovenia, as well as we will share some experience and challenges that we met during our process. So in Slovenia, we will perform, or we are performing our feasibility study in 3, let's say, little towns in more rural area. So you can see some landscape of these places. So this first one is Sveta Ana, so in the northeastern part, close to the border with Austria. The second one, I'm sorry for this. So the second one is actually the Žalec. And the third one is Renče. This is close to Italian border. So within these towns, we recruited experimental as well as control groups. So in Renče and Sveta Ana, there are experimental groups with 23 and 21 children and their parents involved. And in Žalec, there is a control group. So based on the design of the study, we recruited, so the healthcare professionals were the, let's say, core of sampling. So within Sveta Ana and Renče, we have a pediatrician who is responsible for the team. However, this team is a bit different within these two towns. So in Sveta Ana, we have the really multidisciplinary team with kinesiologist, nutritionist, psychologist, nurse, and of course teacher, who is responsible for recruitment, as well as then working also with children in school setting, because our pilot is combined. So it's using the design that everything starts in school, and then based on the prediction, the model could be prolonged in the healthcare setting. And we are using these solutions to address parents of kids of 10 to 12 years old. And within the Žalec, we are having this control group, which is led by 2 teachers. And within the healthcare setting, we have a kinesiologist. So altogether, we have 14 people which are working with a SmartCHANGE application presented by Valentina. And of course, we have parents of almost 50 kids who will work with Happy Plant application. Since this application is on our level of kids, this application will not be used by kids by their own, but parents, since this was also a limitation that we incorporated in our study design, not to burn kids with additional screen time. So recruitment process was very interesting. So on the right side, you can see that the pediatrician who addressed this issue of lifestyle of kids and also presented the idea of the project to the parents, and those parents who were then interested were invited for more information, as well as to present them details, like also the measurable device that is used. You can see here on the table, they received these smart trackers. We used also combination of in-person meetings as well as Zoom meetings to present parents the whole idea and to invite them. However, interestingly, we had a challenge to recruit a control group because we can offer them a little bit less than experimental group, because control group, it's meant to be only to wear these devices with some limitations of happy plant application, to see if there would be, or to control the effect of wearing devices mostly. And within the control group, we faced the problem that in Žalec, one of the parents was very negative towards the artificial intelligence solutions. Therefore, we faced, let's say, bad response rate, and we are still dealing with this problem, but we will handle this within next week. So another approach that was used, especially since we had a problem in this control group, that we try to provide them some meaningful information about what we are doing. So we performed a workshop how we can monitor our usual day, and so activities and also feelings that are associated, and reflection on this as well. But within this project, we are not using like paper and pen, but we are using smart trackers to record this and provide also the meaningful feedback for them, as well as to healthcare practitioner if necessary. And we introduce them the, let's say, regular check-ins and a regular identification of health issues, and describe them the idea of pretty early detection of possible health risk. So this is main idea of a SmartCHANGE project, and we try to simply present them the whole idea behind that, also what actually is monitored by these physical fitness trackers, so 24-hour movement behavior, as well as within the application we are collecting also some data on nutrition and well-being, and this is then resulted in physical fitness. Another point that was discussed among parents was what is actually artificial intelligence, and how this artificial intelligence is already used, for instance, in Slovenia, since in Slovenia we have a My SlowFit application for monitoring physical fitness of kids, and more than 275,000 users are using the application, and within this we already have one implementation of the AI. So similar like we developed within the SmartCHANGE project, this is for forecasting final height of some kid. So they already have some, let's say, picture how this can be explored also for purposes of our project, and we describe them how this this machine learning actually is working to forecast the height. Another thing is that within this SlowFit application, we already now have a monitoring of 24-hour movement behavior. However, it is based on questionnaires, And we then, based on this, described the idea which is behind the prediction model in SmartCHANGE. So to predict based on the current lifestyle and current fitness, to predict the behavior as well as health outcomes of person being 55 years old. And this is associated, of course, to collect data about lifestyle via the Happy Plant application. And this is also shown in SmartCHANGE application for healthcare practitioners. Then our scenario is also including pushing the data of fitness data from the MySlowFit database, pushed to SmartCHANGE application for the health risk prediction, and we described them this function as well. And finally, of course, we introduced them also the device that will be used, as well as short functioning of Happy Plant to facilitate the involvement, as well as also to facilitate the whole processes that are behind. We created some infographic with 10-step approach. So how parents can be involved in this study. First, they should sign the consent, and then they receive the message with the access to application Happy Plant, how they download application, etc., get the device, and also, of course, that they should tweak the synchronization once per week, etc. So all the key information are on this flyer, which they received also during our communication. So one part was also dedicated to transparently communicate about the data protection. So we communicated with them which personal data will be collected during study, and which data will be treated next in some analysis, as well as that the data is stored currently in Slovenia and will not go out of European Union. And who will access this personal data, it was also communicated, so they really know how data will flow around, as well as we introduced them some AI and ethics challenges. So we introduced them how AI will be used in specific parts of this study, as well as, of course, that they can also ask for more questions, and if they feel that their rights are somehow violated, that they also have a right to comment this on the Commission of the Republic of Slovenia for Medical Ethics, where this study was approved. So this is from my side. Back to you, Diego.
Thank you, Gregor, very much. So that's how the study is going to be implemented in Slovenia. I will now pass the floor to our first duo of the webinar. So I'll pass it to Tuija Tammelin and Heikki Laaksonen from JAMK, University of Jyväskylä in Finland. Thank you.
Yes, thank you very much, and regards from Finland. My name is Tuija Tammelin, and I'm here with my colleague Heikki Laaksonen.
Hello, everyone.
And we are going to share the presentation on feasibility study in Finland in Finnish schools. And we are both working at JAMK University of Applied Sciences here in Jyväskylä in central Finland. And in Finland, the feasibility study will be conducted in schools and school healthcare. Earlier in the development phase, the co-design of the apps was done together with Finnish adolescents at schools and also with Finnish school health nurses. So this picture is about our health nurses team participating in participatory design phase. Now it will be really exciting to see how these developed tools will work in practice. So in Finland, a feasibility study will be carried out in comprehensive schools. And we have recruited 8 school nurses and 120 pupils from 5th and 8th grades, and they are 11 and 14 years old. And they come from 6 different schools located in central Finland. And in feasibility study, children and adolescents will use the mobile app and Garmin activity trackers. And school nurses will use the web-based tool and monitor children's progress, and they provide support for children's behavior change. And in the study, the primary outcomes will be the feasibility, usability, the explainability of the tools. And this kind of data will be collected through surveys and focus group interviews. And as secondary outcomes, we will also evaluate the changes in the calculated health risks, changes in lifestyle behaviors, such as physical activity, and also changes in health outcomes that will be measured by school nurses at their office. And why did we choose these 11 and 14 years olds to participate in the feasibility study in Finland? The reason is that this is the age groups when fitness tests are carried out in Finnish schools. And we have a special MOVE system, a national monitoring and feedback system for all 5th and 8th graders to evaluate their physical fitness. And the main purpose of this system is to encourage pupils to take responsibility for their own physical fitness and provide support promoting an active lifestyle. And these MOVE fitness measurements will be conducted during physical education lessons, and the MOVE results will be taken in expanded health checkups conducted by school nurses. And parents, guardians are also invited into these health checkups. And the future scenario is that potentially we can use the SmartCHANGE tool in this kind of context in Finland in future. And Heikki Laaksonen has been very much involved in the recruitment process, and he will continue with this.
Thank you, Tuija. So we want to raise some points from the recruitment process in Finland for this feasibility study. So in Finland, the school nurses are working in these exact schools that they are responsible of. So before we can recruit the children and adolescents from these schools, we need to make sure that the school nurses at this certain school are willing to join the study, and therefore we needed to use this kind of multiple phases of recruitment to first recruit the school nurses from this certain school, and after that we only could start recruiting the school and the adolescents and the children from that school. The children and adolescents were recruited from 2 pathways. So we held this kind of recruitment events at the classrooms where we present the study and what it would mean for the children and adolescents to participate, and also through the school nurses visits where they directly invited some of the children or adolescents to join the study. From the recruitment process, we also want to highlight this kind of collaboration we are having with the local welfare district, which gives us opportunity to the school nurses to have these study visits held at their working times, which means during the school day, and therefore we don't need to make the kids come to this visit after the school or some not so appropriate time for them, and with this way to maybe increase the adherence towards the study from both school nurses and from the children's side. Initial impressions from the recruitment process was that the 11 years old were more keener to participate to the study than the 14-year-olds, but we still managed to get both age groups included in the feasibility study. And now we are done with the recruitment process, and next we are starting the feasibility study soon. So for the start of the study, we are planning to have these events at the participating schools where we deliver the Garmins for the participants and also ensure everyone has their activity tracker and the happy plant running correctly in their phones, and make sure there's no any problems with the start of the study regarding these. But also we provide them instructions how to use the applications and also information about the study for the participants themselves and for the parents, meaning like who to contact during the study and what the study is consisting of. And this is especially important in Finland when we have the children and adolescents are the main users of the applications. So parents are not that hugely involved. So we also want to inform the parents about the study so they are better on track what's happening with the study. And after that, when we have delivered the Garmins and the applications, the children and adolescents start using the application, and by soon after that they attend to the initial meeting with the school nurse to begin with the study also. And we are excited to see how this collaboration will happen in the near future. For the end of our presentation, we also want to share the opportunities we see with these applications and also some local topics that are related to this feasibility study we are conducting now. We see a great opportunity in the applications and how they can help school nurses work by putting together relevant information of child's health factors and therefore help the nurse to better evaluate the health risk of the child. Also related to these applications, we see this device measured lifestyle data is not used in the school healthcare setting in Finland before. So now when we are using this, it allows school nurses not to lean only on the interview-based lifestyle data that they might ask from the children during the visits, but also they see how device has recorded, for example, physical activity levels of the children, and they can also kind of get that information better for themselves to help in their decision making. Some other topics we want to raise from Finland specifically was that there's this change in legislation in Finland that restricts the mobile application use in the schools. In central Finland area, there were some schools also that restricted the use of smartwatches during the school days. And as we see this study, the use of Garmin during the school days is quite important to collect the data. So we got permission that they can use the Garmin during the school days, but they also say that it can't cause any problems during the classes, of course. Also, one topic was these new guidelines for digital device use for children are in progress, and they're prepared from Finnish Institute for Health and Welfare and National Agency of Education. In these guidelines, what they're preparing now is recommending that younger than 11-year-olds should not have their own digital device in use. And now we are complying with this guideline that is in progress. We have only 11 years old that are having their own device and using the application, but we want to raise this legislation and guidelines to this webinar as a topic because these are some things that we maybe need to think in the future when applying these kind of interventions for children in school environment and how we can comply with this legislation and also with the guidelines related to this. And that is all from our side. Back to you, Diego.
Thank you.
Thank you, Heikki. Thank you, Tuija. Moving on now to the second duo of our webinar from VUMC in Amsterdam in the Netherlands. We have Mariette Hoogsteder and Claudia Dictus. Thank you. You are currently mute, Mariette.
I'm sorry. I'll do it again.
No worries.
Let me see. Okay. Hi, everybody. My name is Mariette Hoogsteder, and I'm presenting our feasibility study plan from the area of Amsterdam and the region around Amsterdam, together on behalf of Claudia Dictus and Tetske Altenburg. So we are taking a little bit a different approach than just presented in Slovenia and Finland, because we would like to have a realist ripple effect mapping approach of the Happy Plant app use, and I will explain you what that is. And we will do this in 3 different phases. I'll explain them. So the first phase is evaluation team formation and piloting. And we will try to include 6 to 10 adolescents who were earlier involved in the co-design of the app. And their age will be 14 to 16-year-olds. And then pilot testing of the app due to technical issues and all things like that. With this team, with these adolescents, we will also planning recruitment for new participants of using the app and for recruitment incentives. And then we will learn them how the realist ripple effect mapping approach works. And what you see on the screen is, well, the realist ripple effect mapping is a mixed method approach that combines visual mapping, and that's what you see on the picture. And this visual mapping is measuring intended but also unintended outcomes of a certain program, intervention, or app, in this case, the Happy Plant app use. And the realist refers to combining this visual mapping with underlying mechanisms and the context of the outcomes. So the mechanism is how, and the context is why certain effects occur. When we will do this, we will start with the phase 2, actual recruitment and app use. And we are intending we will try to use or to recruit 50 adolescents aged 11 to 14, recruited together with the evaluation team I just told about, at the same age group as just Finland talked about, but they in our school system, they are in secondary school, because children from 11 or 12 years old, they go to secondary school. And then with this group, they will use the app for the minimum of 2 weeks, and we'll have a weekly evaluation of continued use of the Happy Plant app. And the third phase is the actual realist ripple effect mapping, and we will coordinate workshops with them, co-facilitated by the adolescents, by the evaluation team, And this is what Joe just talked about. It's a combination of visual mapping for what kind of outcomes they, the users, perceive, and then detecting CMOs, meaning context mechanisms related to the outcomes. And also we do the final analysis of findings together with the evaluation team. And from the part of the healthcare practitioners, we will have a transdisciplinary research panel evaluation of the healthcare practitioners app, also in 3 stages or 3 phases. And phase 1 will be use of the healthcare practitioners for workshops and recruitment at existing events. For example, the health events, and also we have a lot of events in the Academic Collaborative Center on Youth and Health, with its existing collaboration between our research team and 7 preventive youth healthcare organizations in the bigger Amsterdam region. And also we have physicians who are trained to be public health physicians as interns or residents, so we can have these existence with the events with them. And we will contact youth healthcare centers through our network. And then compare the SmartCHANGE practice to existing practice and what it adds or maybe have problems with. And the last phase with the healthcare practitioners are panel sessions, and the exact subjects and outputs are to be determined together with them. And also we will try to integrate the healthcare practitioners' perceptions of the app used together with the teen evaluation team, so we will have possible collaboration of them. So that was it from the Amsterdam side. So the word is up to you, Diego.
Thank you, Merit. So we now have the presentation from Portugal. As said previously, unfortunately, our colleague Jose is unable to be here today, so I will briefly show the Portuguese presentation. Anyways, we have the fortune that this study infrastructure is validated also in the study from Taipei, which follows a similar setup. So there will be more information about the logics of it there. So this is just again a quick showcase of what the study is integrating. So the main tools that we discussed previously as per the other study sites. And looking at why Portugal specifically, it has a peculiar setup. So this is actually in the original conception of the sites. This is the only one that is not taking place in what we can say is a fixed location, but is leveraging a network of pediatricians that are meeting one-on-one with families. So the study is going to be executed through a non-randomized trial with control groups. We are looking at families that have children between 6 to 10 years old. So the primary interface is the family itself, it is the family of the child rather than the child itself. And the site will be interfacing with approximately 100 families. So 50 will be the families that are undergoing the actual experiment with the feedback provided by the applications, and the other one is the control group. The setting for the pediatrician meetings is the hospital in Porto, and the recruitment is happening between the partner University of Porto and the network of pediatricians and family doctors. So we are reaching out to them, and then in turn are doing recruitment with families. So exactly because of this, the recruitment is happening during the regular checkups. So families are invited to participate in these in the study site through information and brochures that we have distributed, or that the University of Porto has distributed through the network of pediatricians through their meetings with them at the Faculty of Sports. Additionally, we then have a follow-up from the pediatrician to the family if we have no reply with 15 days. So we try to stay close to the family that are interested in participating. On the right, you can see one of the brochures that has been delivered to them, containing essential information on what the site actually involves and what will be the results of the site. And additionally, we are providing the participating families with a Garmin device as the other pilot sites, so they can go through with the physical activity monitoring. These are the two tools as explained previously. No need to go too much into detail about this, but as I said, all of the sites are using the same two tools and will be gathering different kinds of feedback depending on the interactions that they're having between the healthcare professionals and the families. As mentioned previously also by Valentina, the healthcare professionals are interpreting the AI-generated or AI-assessed risks. So the families and the children do not get this, but they are provided through the pediatricians, who then have to define the intervention areas and work with the families to set smart and actionable goals. The objective through the pilot site is, of course, to see how these interactions go through, keeping in mind the fact that this is not a fixed setting, and so we have periodic encounters between the families and the pediatrician, and seeing how the progress can actually happen in between these meetings, and seeing how the app is received from the family and the children. So the expected outcomes is first to finish going through with the adherence to these meetings and to the feedback that is prescribed by the web app and the mobile app. They will be looking at the usability. So both from the family and the healthcare professional side, what is the satisfaction and also the engagement rate? Do the children actually keep the monitoring device on? Does the family actually follow through with what the mobile app says, and do they follow the indications that the healthcare professional gives through thanks to the web app? As well as seeing how much, what is the degree of understanding of the families and the trust in the applications that they're using. And on the healthcare professional side, we'll be seeing whether this pilot site ends up having concrete changes in behavior and then in outputs, so BMI, activity levels, etc. Finally, with this collaboration between pediatricians, the pilot site hopes to promote early health literacy and prevention, which is the overall goal of the project, essentially. Strengthening collaboration between the families themselves and the healthcare providers. Supporting clinical decision-making with explainable AI, so providing the healthcare professionals also with the reasons why the application is providing certain suggested interventions. And then this can be a first initial model for a scalable type of infrastructure for other EU countries, as indeed the model of pediatrician in hospital is quite relevant for many countries, Italy as well. All of this for this pilot site, but also by others, has been constructed following compliance with GDPR and local ethics committees. So this, as someone who's internal to the project, I can tell you that this has been indeed a long and ongoing conversation. And the pilot sites have gone through a lengthy process to ensure that they have gathered fully informed consents from the parents and assent from the children as well. The data in this specific case, all of the data is stored locally through the partners that are administering the pilot sites, and only the models are then analyzed centrally. And that is the overall explanation of the Iporto site. For some more technical details, I will now pass the floor to Sherali from Taipei Medical University, who is running the feasibility site in Taipei, validating, let's say, the initial conceptual setup of the Portuguese. Thank you, Sherali.
Thank you, Diego. Hello, everyone. I'm Sherali Bomra from Taipei Medical University, and I will briefly present how we are preparing the SmartCHANGE feasibility study in Taiwan. Just a second, I'm not able to. For some reason, I'm not able to go to the next slide. Just a second. Okay. This is the outline of the presentation. I will be covering it in 3 parts. First is the overview of the study, secondly, the implementation framework, and finally, the progress, challenges, and next steps. Beginning with the introduction, so Taiwan is one of the international feasibility sites in the SmartCHANGE coordinated by TMU. So all these hospital pictures which you see on the slide is associated with the Taipei Medical University. So our site basically represents an Asian healthcare setting, contributing the regional perspectives on patient engagement, workflow integration, and cultural adaptation of SmartCHANGE. Okay, coming to the objectives of the Taiwan site. So the primary objective is to examine the feasibility of implementing the SmartCHANGE tool in Taiwan's hospital settings. And in terms of the secondary objectives are concerned, we want to try and understand how the healthcare providers, parents, and children perceive and interact with the SmartCHANGE tools. Also exploring how AI-generated health risk predictions can be made more explainable and trustworthy. Okay, this is the study design. So basically, this will be a non-randomized feasibility study, which will be conducted for over 6 months. And we are going to follow the healthcare provider pathway, where the pediatricians meet the family adolescents for the pre-scheduled screening. And if they are interested in the study, they can join. And we are currently planning to recruit approximately 100 children from the age 10 to 14 years. And considering we want to divide as 50 intervention and 50 control cases. In terms of hospital sites, we plan to implement it at the 2 teaching hospitals which come under the Taipei Medical University, which is the Shuanggo Hospital and the Wanfang Hospital. And also, as far as the interventions are concerned, there'll be obviously Happy Plant app, SmartCHANGE web app, and the Garmin wearables. Coming to the recruitment and the participation flow. So here is the overall flow of how the participants will join and progress through the study. The recruitment begins with healthcare providers identifying the children during routine visits, and once the interest is expressed, parents can consent and children can provide their assent. And then during the baseline phase, the participants are oriented, issued the wearable device and onboarded to the Happy Plant app for self-monitoring. And then obviously the main part comes in where the goal settings is important, which will be done by with the coordination with the pediatrician, children, and the parents, so that ensuring shared responsibility. And the final part will be the follow-up, which will occur at month 3 for midterm review and month 6 for the final assessment. Okay, so for the intervention components, I think in the previous presentations, it's been already covered, so I wouldn't go much in detail. But I would like to quickly take a look at the user enrollment flow. So this flow has been kept really simple so that I think participants can get on board hassle-free. So you can download the app and you'll be shown a quick intro video where you can get, basic details about SmartCHANGE, what it's all about. Then the adaptation of the plant starts, and then the usual stuff like agreeing to the privacy policies. And then you'll have to answer a few questions based on your diet and sleep routine and all of those basic questions, so that we can better understand the participant, and finally sync the wearable. Coming to the feasibility outcome. So I think assessing the practicality, acceptance and scalability of SmartCHANGE in real-world healthcare workflow is highly important. And so here we are going to concentrate on 7 domains, namely acceptability, demand, implementation, practicality, adaptation, integration, and expansion. So basically, this serves as an evaluation framework for all feasibility sites, including Taiwan, ensuring consistent measurements of how SmartCHANGE basically will perform in everyday health and school environments. In terms of indicators are concerned, we include the recruitment success, the engagement rate, resource requirements, etc. And basically, to measure all of this, we will use the mixed methods, which is survey, app usage data, focus groups, semi-structured interviews with healthcare practitioners. And finally, we are also focusing on the provider experience and workflow functionality, capturing the pediatrician's perspective on the system usability and workload. Coming to the clinical outcome, I think it's a highly important aspect, and it's been also talked about earlier. For the first of all, it is the primary outcome is the aggregated risk reduction, whether there's been any change in the overall cardiovascular metabolic health risk score prior and after the use of the intervention. Second is the behavioral and lifestyle changes, whether there were any improvements in physical activity, sleep quality, and reduction in screen time measured via wearables and app data. And lastly, the physiological indicators like tracking the changes in BMI percentile, waist to height ratio, and blood pressure between the baseline 3-month and 6-month feasibility period. Okay, coming to the progress so far. So we have already obtained the local ethical clearance for conducting the SmartCHANGE feasibility study. So the pictures basically you see here are from the Wenfeng Hospital, which is one of the affiliated hospitals from TMU. And this is actually the entire pediatrics department of Wenfeng Hospital. And we are sort of having this meeting with them, trying to make them understand what SmartCHANGE is all about, what's the essential idea. We also tried to show them the prototypes of the Happy Plant app and web app, and trying to like understand if they have like any feedback or any questions. So up till now, we have recruited 2 doctors and 2 nurses. And as I mentioned that we have conducted multiple coordination meetings already with them, so that in that way we stay in touch with them and also keep them updated with whatever progress we are making so far. So in that way, they always remain in the loop. In terms of server requirements, all of that is also being taken care of. And we are already doing the preliminary testing of the app usability, data linkage, and wearable device setup. Personal data protection and privacy measures, I think it's a very top priority and needs to be addressed. So the data which will be collected will be in these broad categories, namely demographics, physical measurements, behavioral data, and lifestyle data. To protect the privacy, obviously each patient will be assigned like a coded study ID, so that their essential details like name, contact details are replaced with that, so that it never gets out. And so this basically allows for data analysis and cross-site sharing. In terms of data storage and security, all study data will be securely stored on TMU's local server. Talking about the anticipated challenges and strategic adaptations. So I think one of the challenge is about maintaining engagement and adherence over 6 months, which is like quite a time for, even if the participants show initial motivation, but it's important to keep them engaged over the whole feasibility period. Second is ensuring privacy and responsible app use in school environments or at home as well, aligning digital autonomy with parental oversights. So I think for these challenges, we have some solutions. So gamifications through streaks, I think it's an important aspect of, keeping participants engaged with the app, so that they keep interacting with the app on regular basis. And I believe the adolescent version will have like a social feature called the park, where they can, share commitments and like each other's goals and share the achievements as well, so that it will also help, for them to keep using the app and keep motivating each other. And lastly, age-appropriate consent and parental communication materials. I think it's important to make the participants and parents understand that what exactly, they'll be going through the 6 months process, and what will happen to the data and how the data will be used. So all of that communication, prior communication will be important. Coming to the next steps, I think soon we will be starting with the participant recruitment through our 2 TMU affiliated hospitals. And if needed, we'll provide them some training for them to get used to the onboarding sessions and if they have any queries prior. And third is obviously the implementation phase where we'll deploy the variables and begin the participant monitoring. And lastly, data consolidation and reporting. Okay, thank you. That's all from my side. Thank you so much for attending the webinar. Back to you, Diego.
Thank you very much, Sharali. All right, we are now going to move a little bit earlier than expected to the Q&A session. So let me get back to there right away. So if you have any questions, feel free to type them in the chat. I will start actually by asking a question to the two representatives of the apps that have been developed. So I'll start with Harm, and then I'll ask the same question to Valentina. So Harm, can I ask you what the biggest obstacles have been to the development of the mobile application, and what kind of feedback are you expecting from these feasibility studies?
Hi, Diego. No obstacles at all. Everything's fine. I'm just kidding. So what we did when we started early in the project with co-designing the Happy Plant application is to be very open, have a very open mind about the possibilities. So that means that, and I think that was a good decision because I mean, the scope of a project is limited, but after the project, we can still continue working on this. So we started with a very open mind and created a design that is very comprehensive. So for example, things that I did not mention in my presentation, but the previous speaker mentioned about the social goal gardens where you can share experiences between users is something that came up as important from the design. But all of the different features that were defined there altogether would take years to properly implement. And so the biggest obstacle from a development point of view is to get our feet back on the ground and see what's actually realistically achievable to get done in the limited time span between the design period and the start of the trials. And that means that we have to cut some features. That for sure has been the biggest obstacle. And in terms of what we are expecting as feedback is, well, what we hope is that we didn't cut so much, we didn't have to cut so much that the application loses its value, right? So we hope that people see enough content and get enough variety and get enough motivation to actually use the application, use it day in, day out, week in, week out. They don't need to open the application every day, but they need to keep being engaged with the application and then hopefully learn something about healthy lifestyle and maybe improve it. Does it answer your question?
Yes, it does. Thank you, Harm. I'd like to now point the same question to Valentina, but for the web app, of course.
Yeah. Okay. Talking about the obstacles, on one side, we aim to design a solution that was flexible enough to integrate all the differences that were we found in each country through the co-design process. Because we found very different health systems and also practices. And the goal of the web app should be not to change the daily practice, but support it. So we had to find a solution that would be quite flexible and still of support for each country. And also be flexible to support the different nuances that the studies have in the different pilot sites. And on the other side, what also are mentioned, we had to find a balance between what user wanted and also the constraints that were given from a technical and research perspective, and also the time and effort constraints we have in the project. Regarding the feedback, what we want to know mainly is if practitioners find the tool useful, of course, and it supports them in their daily activities, and also if the risk prediction models are well explained, and if how the information is presented in the web app is useful to drive the behavior change plans. Yes, these are the two main points that we want to know about.
Thank you, Valentina. So talking about feedback from the studies, I think we can now actually ask the same question to the people that are handling the feasibility studies actually on site. So which is what kind of feedback are you looking for during these studies, and how will you analyze it? So if we go in order, I'd like to start with Gregor. So Gregor, what kind of feedback are you expecting? Are you looking for from the study site in Slovenia, and how are you going to work with it?
Yeah, hi again. So since we are involving teachers, healthcare practitioners, as well as parents in our scenario, so we are looking for the feedback about the feasibility of this pathway, as well as usability, and we will monitor also engagement rate of parents here, as well as we will look for we will try to get the feedback about the explainability of the solutions that are incorporated in the SmartCHANGE application for healthcare practitioners. These are 4 main domains that will be addressed in our analytical part. And to get the information on this, we will use mostly workshops with them. So we already started with this workshop for the introduction part. So when we introduce them, the applications as well as the whole feasibility study. And at the end of the period, we will perform workshops again with them to address all these domains. Thanks, back to you.
Thank you, Gregor. The same question goes to Tuija and Heikki from Young in terms of feedback. What do you expect?
Okay, thanks, Diego. In Finland, we have been discussing that we are really expecting to get very different kind of feedback from the adolescents and children from different age groups, for instance. And I'm really excited to see how long they continue to use this app so that they feel it's motivating, and I'm interesting to hear how they experience it, and is it affecting their health habits. And for school nurses, we are looking for the feedback about how the web app is supporting their work when they try to promote the well-being of young people. So, and we will have this from focus group interviews and surveys. Yes, thanks.
Thank you, Tuija. How about in a similar setting, which is that done by VMC? VMC, Mariot, what can you say about the feedback?
Yeah, I think it compares very much to what Tuija just told about Finland, because we will expect feedback from the adolescents about the use, their experiences, the acceptability of the app, their motivation, etc. But as I presented in my presentation, also the underlying mechanisms and context. So why is it, for example, do they stop using it, or why do they are they motivated? So also to try to get a grasp of the mechanisms and the context in which these outcomes arise. And on the path of the healthcare practitioners, we are mainly interested in whether they would like to integrate it in their usual practice, this kind of app, and under what conditions. Yeah.
Thank you, Mariette. So moving now to a different setup for the pilot site. Well, I would ask Porto, but unfortunately, as I said, Jose is not here. But we have Sherali, who is, of course, running the pilot site with a similar setup. So, Sherali, what kind of feedback do you think that the pediatrician type setup will be looking for from these studies?
Yes, actually feedback would be like very essential. So from the pediatricians, we want to know like, how feasible it is to implement the SmartCHANGE web app into their clinical workflow and how they're able to maintain it with their general workflow. And in terms of adolescents and parents, obviously from the adolescents, we want to know that how engaging they found the app to be. Because when we were having a workshop with them earlier during the participatory design phase, they all gave us the feedback that they have never had a chance of using like a app similar to like SmartCHANGE. So it would be interesting to see that once they start interacting with an app like Happy Plant, how their reaction would be, and whether they'll be willing to use it, in the future as well. So that is there. And in terms of healthcare providers, obviously, as I mentioned, that how SmartCHANGE fits into clinical workforce would be a critical feedback, which we plan to take via, say, interviews, like preparing some questions beforehand and trying to ask them some specific questions about their interaction with the web app. So yeah, that would be pretty much it.
Thank you, Sherali. So now that we've covered this, moving on, we have a question in the chat, which is what trajectory of active users do you anticipate over the duration of the study? And if it dips too much, what is the best way to counter this? So this is aimed at the feasibility studies in general and not at the specific site. So I will just ask if anyone from any of the pilot sites wants to weigh in on this. What is your opinion on this, and how do you think we can make sure that this number stays strong throughout the duration of the study?
If I can try to reply on this, so yeah, we already know from other studies that we will face the dropout after some time when application will not be any more interesting enough for kids. However, we are counting on parents, so that in our scenario, because we have parents involved, that they will continue with this, and we will try to engage parents through communication via teachers. So our main alliance here will be with schools, communicating with teachers, and maybe providing them also some information which would be interesting for them. However, we believe that not all kids and parents will finish the period of feasibility study. So we have to count this also when the study will be then analyzed.
Thank you, Gregor. And if anyone else want to add their two cents to that?
Yeah, I think it's an interesting question. The best way to counter, because I think everybody might expect that there is a drop after a certain amount of time. But I think the best way to counter this is that's what also is the intent to do the feasibility study, so that adolescents, the children and adolescents themselves will provide us with information about that. The best way to counter dropout or less use, and what would motivate them. So I think it's important to not to have pre-arranged ideas of countering this, but to be in dialogue with the people using it, and the same part of the health practitioners. Yeah, I don't know if this adds something, but I like the question.
Thank you, Mariot. All right, very well. If there are no further questions, I think we can move to the closure of the webinar. So I will just quickly change slide. So the next steps for us and for you as well. First of all, we encourage everyone to sign up to the newsletter on our website to receive major updates every few months. We promise we don't abuse this tool, and we only send out updates when we have a good amount of consistent updates to send out. So you can expect it once every 2 months or so. This is the best way to keep an eye out and receive good updates on what the project is up to. Additionally, you can follow us on a variety of different social media. So on the website, you can find everything on the website, both the newsletter and the social media. We have a bit of everything, whether you're more interested in following this through text or through videos or through photos. We have LinkedIn, YouTube, Instagram. We also have Zenodo for our research. And those are the next concrete steps you can do. You can expect to see a number of events coming up in the following months, scientific conferences as well all throughout Europe. So best to follow us there to be updated. And most importantly, of course, remember to stay healthy. So with that, thank you all so very much for your participation and for your time today. Thank you for being here. As mentioned previously, these resources will be shared online on the website and through social media. Hope to see you all again in our next event, and thank you very much. Goodbye, everyone.
Thanks, everyone. Thank Diego.